And may I say also that over that period of time, we know all too well how compromising and sometimes devastating mental health challenges can be. And we have long-standing concerns about those many, many young people, particularly racialized and otherwise marginalized young people, in terms of their access. There's a health equity issue here that has been a concern of ours for decades and decades. And the wonderful thing about Minister Bennett is that she is here to announce a new initiative that I won't speak for you, but will bear on this very important issue. Minister Bennett, in particular, we want to welcome you and thank you for 25 years of service to this country as an MP, occupying many different ministries over this time. And today, she represents a new portfolio, of which you are the first minister, of mental health and addictions. Minister Bennett is also the Associate Minister of Health, federally speaking, and prior to all of this, was herself a practicing physician. So she knows whereof she speaks. I had the opportunity to spend some time with Minister Bennett, and her enthusiasm for this portfolio, I think, will serve you very well, but as important for Canadians across the country who need better care and better health, as we discussed. So without further ado, I'd like to turn this over to you. And thank you for joining us.
Well, thank you so much, Heather, and hello, everyone. And it is exciting to be here in community. I think that I was saying to Heather that I was born at the Wellesley. I trained at the Wellesley. This is sort of where I, feel at home. And that's why we're so excited at being able to do the announcement today it's about 6 projects, but we're really happy to come to community to be able to announce the importance of the work that we get to do together now. And so, avant de commencer, laissez-moi reconnaître que je vous parle depuis Toronto, situé sur le territoire traditionnel des Mississaugas et de Credit, où nous honorons tous les peuples autochtones qui ont pagayé ces eaux et dans les mocassins ont parcouru ces terres. It is really exciting to be home in Toronto to get to do this, to play hooky from question period today, and to be home. And I know Minister Ian would very much like to be here as well, but she was unable to get out of house duty. So it's these last couple of weeks in Ottawa are always just jam-packed. So I'm very excited to be here. And I just want to say thanks to Heather, really, in terms of your explanation of really the importance of the Central Toronto Youth Services, its history, and how really it is about being able to address the needs of some of the people with the greatest needs. And so it is for not only what you're able to do across the whole of Toronto, but I think what we're going to learn today is that the project that is being funded and announced today will be able to spread and scale to help people across the whole country. So it's I was saying to Heather that in terms of so many partners working together in Toronto, that I was reminded that fondly of being the family doc for some of the Youthdale clients, which I know is one of your partners, and that the day that one of my former patients from Youthdale came in as the youth worker with that sort of next generation of youth, and that she was there accompanying this new person, and she'd become a social worker and was now giving back to the organization that had helped her through some really difficult times. I think that I don't think Canadians can ever know how important is the work that you do, that especially now as people continue to cope with the the isolation that was the pandemic, the difficulty, and the effects on not only youth, but their loved ones, their caregivers, their friends. And it was just great. And I know you'll really love hearing from Jordan about the importance of the connections that are fostered here between the young people and their families. Je crois sans hésiter que les 2 dernières années ont posé un défi pour les jeunes et pour la plupart des Canadiens. COVID has taken a toll, and I think all of us know that people are reporting an increase in stress, anxiety, depression, loneliness, especially those facing additional challenges because of racism and discrimination and socioeconomic status or social exclusion. Près de la moitié des Canadiens ont reporté que leur santé mentale s'est détériorée durant la pandémie, incluant 7 travailleurs de la santé sur 10. It is, I think that we're now being a bit more honest, that when people are talking about the pandemic recovery, people have been unfortunately using the phrase getting back to normal. And I think my youth council has been pretty clear. They don't want to get back to anything. They want us to leap forward into a time where things are just fairer and greener and more inclusive and less judgmental. And I think we believe they're right, that when I think of us long to get back to the people, places, and activities that we've missed, we don't really want to go back to normal. The truth is we don't want normal, we want better. And un futur meilleur, plus sain, qui va bâtir sur les leçons que nous avons appris avant et durant la pandémie. I think that what we're seeing in some of the programs that will be funded today is a future where there is listening, understanding, and being there for one another without judgment becomes the gold standard. And that if we want to advance a vision where all people have dignity and access to culturally safe and trauma-informed services that meet different needs, we have to meet people where they are. And Heather and I had a good chat about how we've been expecting youth to change, to adapt to our systems that don't work for them, instead of our systems changing to actually better be able to address the issues of young people and to meet them where they are. We can't expect them to adapt to the same systems that haven't served them well in the past. Our systems need now to adapt to their needs. So that's what today's announcement's about. Comme Premier ministre fédéral de la santé mentale et des dépendances, je suis déterminée à m'assurer que la population canadienne ait le soutien et les services en santé mentale dont ils ont besoin pour prospérer dans leur vie de tous les jours, et que ces services deviennent une partie intégrante de notre système, nos systèmes de santé. So here's the drum roll. I'm pleased to announce the investment of $8.6 million through the Government of Canada's Mental Health Promotion Innovation Fund to promote mental health and well-being in our communities across Canada, across Ontario. So this is the Ontario tranche of what is the national program that we were able to announce in the period when Ontario was in an election, and therefore you had to wait. So the Mental Health Promotion Innovation Fund provides national funding to support the delivery of community-based programs in mental health promotion for infants, children and youth, young adults and their caregivers. And today's funding will go to 6 organizations for innovative projects across Ontario, including a knowledge development and exchange hub. So, and that actually helps with the knowledge translation and the ability of sharing the ideas that are working. And these projects really are designed to support those who need it most, including people facing disproportionate barriers to mental health supports and services. So this includes First Nations, Inuit, and Métis, the 2S LGBTQIA+, newcomers, refugees, and people with other socioeconomic risk factors. Hospital for Sick Kids in Toronto is receiving $1,325,000 to further implement and evaluate and scale their Nurturing the Seeds strength-based health intervention designed for Indigenous children birth to 6 that focuses on the promotion of infant and early mental health. University of Western Ontario is receiving $1,290,775 to further implement and evaluate the supporting transition resilience of newcomer groups, a small group intervention to promote resilience and reduce the psychological distress amongst newcomer students by promoting individual strengths, building skills to make positive choices, and providing a sense of self and belonging. L'Association francophone à l'éducation des services à l'enfance de l'Ontario d'Ottawa recevons 1,350,000 pour consolider leur modèle de formation qui examine les effets de stratégies prometteuses et les efforts conjoints avec des professionnels, les partenaires communautaires et des parents d'enfants de 2 à 12 ans et qui vise à promouvoir le développement sain des enfants à travers des jeux aventureux gratuits. Here in Toronto, the Community Food Centers is receiving $1,323,192 to further develop, co-develop, implement, and test their Mind Your Food program that builds protective factors for mental health in youth 13 to 19 experience food insecurity. At the University of Waterloo, the University College Renison in Waterloo receiving $2 million to continue the KDE Hub. So the KDE Hub is focused on sharing the best available evidence from research and building new evidence for mental health promotion for young Canadians that is sensitive to diverse cultures and contexts. And the KDE Hub hosts the interactive web-based platform to support all of the mental health promotion innovation funded projects to share lessons learned, connect with various stakeholders, and apply the new knowledge to a broader policy and systems change agenda. So, but, we've left the best for last here as Central Toronto Youth Services, our host today, are receiving $1,350,000 to continue the development, adaptation, implementation, evaluation of their Families in Transition program, FIT, which promotes the mental health of Canadian, transgender, non-binary, and gender questioning trans youth and young adults aged 13 to 24. And I'm so excited that you'll hear all about it from Jordan shortly. Their work to improve and promote the mental health of transgender, non-boundary, and gender questioning youth is so important. They provide that safe space and demonstrate every day that these young people are not alone, and also support for their families. Thank you again for everything you do. And I think, as I often think, that Brock Chisholm, the first Director General of the WHO, was a Canadian vet who famously said, without mental health, there can be no true physical health. And that's because all the ways where mental health is interconnected with physical health and central to overall health and well-being. And so I often look to the medicine wheel for my guidance, that aiming to achieve that balance mentally, physically, emotionally, and spiritually, and that the medical model in which I was trained in med school was really just waited for people to get sick and then tried to patch them up. It was really a repair shop model, and we promised since 1986 at the Ottawa Charter that we would move from health care systems to systems for health. And I think that's what the holistic, comprehensive approach that of all of these projects that we're seeing. And so, as we all know, mental health status affects our risk of developing chronic disease, our ability to engage in healthy living practices, shapes our capacity to cope with life's challenges and stress, and strengthens our sense of belonging, which I think is one of the most important indicators that idea of your sense of belonging and connection with others and within our community. Je crois que nous sommes tous d'accord que nous voulons ces bénéfices pour tout le monde au Canada et qu'ensemble nous changeons les choses pour le mieux. Again, I just can't thank enough to taking the time to chat with me this morning and really teach me about all the things I get to go out and boast about now, and as well as gratitude for the important work you do, and being part of this movement for change, as we heard. So, Jordan, the FIT program coordinator, Jordan Zell. Will that do? Yeah. Okay. And thank you. And take it away, Jordan.
Oops, so sorry, I tripped over everyone.
I went straight through the plexiglass.
Thank you so much, Mr. Bennett. I'm always so thrilled and excited to talk about the FIT program. It's a project of passion, and I am the current coordinator. I feel like a steward of the program. I stand on the shoulders of giants. There are so many people that were involved in creating the group and making it what it is, and I feel extremely lucky to be in a position of now coordinating the group. So Families in Transition, or FIT for short, is a multifaceted and really robust program. And the service delivery portion is really looking at two parallel groups. So we run a group for trans, gender diverse, gender exploring, gender creative youth, and we also run one for their parents and caregivers. And both of the groups are focused on some of the key aspects of gender. So we're looking at language and terminology, and we're also looking at gender journeying, specific questions around like understanding transphobia and transmisogyny, talking about gender in different contexts like school or in the workplace or with broader family members. And additionally, the youth group is focused on, building community, finding other youth who have a similar experience or going through a similar thing, exploring identity, and also connecting with that inner and also collective power of being able to make positive change in the world. And the parent group is additionally focused on some strategies and tasks and exercises that are really about strengthening relationships between trans youth or gender exploring youth and the adults in their lives. And we do that because we know that, through research and through our extensive clinical expertise, that strengthening relationships between transgender diverse, gender exploring young people and the important adults around them is like the key, most profound predictor of positive mental health outcomes. So we know having supportive adults in young people's lives actually makes a huge and profound difference, and that's why we focus our intervention there. And the cool thing about that focus is also that it is able to shift the conversation a little bit as well. So we're not looking about determining a destination in terms of gender. We're looking at how do we support a relationship between a young person who is exploring gender and the adults in their lives, particularly in these sensitive moments of moving through or beyond or between different gender possibilities. I want to share just a little bit about locating myself in the work. So as someone who transitioned in the early 2000s and who has also been working in this community since that time, the reason I'm just really passionate about FIT. And the reason is because I think that I haven't ever seen another program that is there's something so special about this program. And I think what it is, there's lots of reasons why it's so special, but I think what it is that often, even today in the media, in dominant culture, we're still sort of engaging consciously or subconsciously or unconsciously around this question about whether or not trans people even deserve to exist. And that does, I don't think many people will say that directly, but that does still tend to feed into different clinical interventions that we still see in lots of different agencies. And I think that what FIT does is it sort of escapes that question by like sort of appealing to a broad range of families and asking a different set of questions. And the questions kind of look like, what actions have been proven to support young people who are exploring their gender to live, to thrive, to, see themselves as really grounded in their families? And what approaches are needed to support young people in terms of their mental health in the context of their families, regardless of where they end up in terms of gender? And I think the sneaky hidden question that we're asking is how, through generosity and through genuine care and a little bit of exposure to real life trans people, can we transform people's fear and hurt and anxiety that often comes along subconsciously when you learn that you're a young person maybe exploring gender? How do we transform those hard feelings into advocacy and into fostering positive change? And maybe I think sometimes the long vision of the group is, how can we continue to plant seeds, not just with young people, but with their families and with sort of broader society, that really shows in tangible ways how creating safety for gender exploring youth actually also creates safety for all of us. So right now, as was mentioned, we're kind of launching into a second phase of our project. Phase one was really focusing on establishing the project and really naming this unique approach that we have in the work, and also evaluating and showing why it works so well. And phase two is going to be really focused on building out partnerships across so-called Canada and really building out our network of community-based providers who are doing this work in different locations and in different contexts. It's just so clear that we wouldn't be able to do that work without the funding that we've received. And so I guess I want to thank you for believing in us and for really promoting the work that we do. I think that gender affirming services are life-saving. And so, I just want to thank you for that support. Thank you.
Thank you so much, Minister Heather and Jordan, for those wonderful remarks. We will now go to the media availability on Zoom.